5 warning signs of breast cancer women often ignore. We can easily say that cancer is one of the deadliest diseases today. While a healthy diet can decrease the risk of developing certain cancer, other factors like genes can play a larger role. Once cancer spreads, it can be difficult to treat. Knowing early symptoms can help you seek early treatment to better your chances of remission. Well, this means that you should ignore these early warning signs, and if you notice any of them, you should see your doctor immediately. And ladies, if the answer is yes to one or more of these effects, it's important to see your healthcare professional immediately. Breast cancer is the second highest killer of women the world over. 1/8 of all women in the USA will develop breast cancer throughout the course of their life, with almost 250,000 new cases in 2016 alone. Apart from lung cancer, breast cancer kills more women than any other cancer going, and women over the age of 50 are more at risk, which is why they should be breast aware at 25. Men are not exempt from breast cancer either, as 1 in 1,000 will develop the disease. Note, these are merely a guideline and are not in any intended to be a diagnosis, so do not panic if you develop the symptoms. Any diagnosis should be made by a qualified doctor with the correct examinations, advice, and treatment. Without further ado, here are the symptoms again. 1. Change in breast size. Ladies, you should be very careful and don't ignore this warning sign. First of all, you should know that this could be a change due to periods, pregnancy, sexual arousal, or anything else that causes a shift in hormones. If it is not normal, you could be doing yourself a massive favor by checking it out further and catch the disease in the earliest of stages should there be a diagnosis. 2. Redness or rash. Redness or rash on the skin and or around the nipple and it remains. Do not be alarmed by something of this ilk if it goes or has gone away. The problem arises when it stays there. That could mean there is an underlying cause and you should definitely consult your doctor. 3. Change in skin texture. Ladies, you should be very careful, and if you find any form of puckering, looking like the exterior part of an orange peel, or dimpling lately in that region, it is high time to have a little chat with your friendly doctor. Some women do not even know that this is a symptom of the potentially life-threatening disease. 4. An inverted nipple. Inverted nipple, this is a nipple that pulls inward, like an innie belly button. Everyone's nipples are different and some are naturally inverted, but if a nipple has suddenly decided to make a move to the dark side, you had better make that doctor's appointment sooner rather than later. 5. Constant pain. This pain is a dull ache in the described area. Sure, it could be anything from your hormones to being struck in that area to